Therapeutic gardens, also known as healing gardens, are spaces designed to improve people's health and well-being through the connection established with nature. They can be used anywhere, but are very useful in hospitals, nursing homes, rehabilitation centers, as well as centers for people with disabilities, among others. And that is why today I want to share with you 10 benefits of therapeutic gardens in care centers, according to scientific studies. My name is Albert Cervera, and I am specialized in the humanization of care environments and the creation of healing gardens. Join me. As I always say, making a therapeutic garden has nothing to do with landscaping or gardening. It goes way beyond that. In my case, in fact, I spend an enormous amount of time and effort in working sessions with the staff, with patients, caregivers, patient associations, to get to know in depth what their real needs are, and then we work together with them down to the last detail so that the project has a real impact. The final point is to ensure that the project has a real impact on their well-being. In parallel, we also do a lot of research on international scientific studies, and that is why today I wanted to bring you 10 of them. And let's start with the ones that directly affect patients. The first one is the improvement of physical health. According to a study from the Netherlands led by Agnes van den Berg, concluded that healing gardens had beneficial effects on lowering blood pressure, decreased pain, improved sleep, and increased physical capacity. In addition, therapeutic gardens were also associated with improvements in pulmonary and cardiovascular function, as well as a reduction in cortisol levels, the stress-related hormone. The second is improved mental health. According to this study conducted by the Department of Psychiatry and Behavioral Neurosciences at the University of Texas, healing gardens were also associated with improvements in mental health, including a reduction in stress, anxiety and depression, as well as an increase in satisfaction and happiness as well. Let's move on to the next one. A reduction in pain. It was found that therapeutic gardens can be effective in reducing pain in a variety of patients, from those who have chronic illnesses, to patients who are hospitalized. And this study looked at the impact therapeutic gardening had on cognition in older adults with dementia. The results indicated that therapeutic gardening significantly improved attention, memory and cognitive function of the participant. The impact of a therapeutic gardening program on the socialization of people with intellectual disabilities was also evaluated. The results showed that those who participated in the program showed a significant improvement in their socialization, in their ability to both interact with others and form social relationships. And now let's talk about the benefits linked to hospital staff. According to this study by environmental psychologist Kaplan, mental fatigue is one of the main factors affecting the productivity of workers. These, when exposed to therapeutic gardens, allow them to recover from direct care fatigue. The challenge is to turn these spaces into a restorative environment. And several studies have also demonstrated that both visual and physical access to nature reduces stress in healthcare personnel, improving alertness and consequently reducing medical errors. Let's see, it's common sense. The hospital staff has to be well to give adequate care to patients. And having these spaces to be able to have a respite after a tense situation allows them to regenerate. Even being able to have a complicated talk with a patient and their family members in an environment that is much kinder really helps everyone a lot. And now we come to the great forgotten ones, the patient's companions, who also go through very complicated moments in their passage through healthcare centers. There is scientific evidence of the benefits for family members of being able to walk in restorative outdoor environments around these healthcare institutions, in particular by lowering their stress levels. Let us not forget that companions can spend many hours with high levels of anxiety, uncertainty, boredom, fear, and anger. And these spaces become real escape routes to sustain the agonizing hours of waiting they have to spend. And finally, the benefits for the centers are very important, because at the end of the day, they are the ones who have to make the investments. And from here, we have numerous scientific studies that show cost savings for patients. The first most famous study was carried out by Robert Ulrich at the Pennsylvania Hospital during almost 10 years of study on patients who had undergone gallbladder surgery. Some looked out of their room at a wall, and the others could see a garden. Sight alone has been shown to reduce the use of painkillers on hospital nights, and also to result in fewer post-operative problems. Studies have shown that a reduction in costs, and above all a reduction, if I may be redundant, in absenteeism, which, let us not forget, is one of the main costs and main problems of healthcare institutions. There have also been several studies that show how, through the implementation of therapeutic gardens, the patient's perception of the care and service provided by the patient towards the healthcare institution has improved considerably. After this more scientific analysis, I would like to share with you a more poetic way of describing the positive effect of nature on people that the landscape architect Frederick Law Olmsted used as early as 65 years ago. The installation of a therapeutic garden is one more tool in the process of humanizing healthcare. As I perceive and have experienced these processes, I can say that they represent a before and after for organizations, obviously if it is done well, because it is much more than installing a garden. It is a total change in culture and in people's experience. Subscribe to the channel if you don't want to miss the next videos, hit the little bell and write me in the comments what you thought and if you have any questions. Thank you very much for your attention and have a wonderful day.